Okay, I'm going to demonstrate how to administer an intradermal injection, and I'm going to use the tuberculin test. So the first thing I'm going to do is check the medical record and the MAR and make sure that it's still needed for the patient. I'm also going to verify that it is the right patient, the right medication, the right dose, the right time, the right route, and I'll document everything when I'm done. So after I've verified everything through the medication administration record, I'm going to go ahead and check the vial of medication and make sure there's no cracks and no crystals in the solution, and there doesn't seem to be, so that's good. I'm also going to check the expiration date on the vial, and it's good till 11 of 2020. So once I've done that, then I'll be ready to get everything going. So I'm going to go ahead and get the medication ready, and you just roll it between your hands, never shake it and make bubbles in there. And I'll pop the top off. I'm going to go ahead and clean the top of the vial with some alcohol, just a regular alcohol pad. Go ahead and get my syringe ready, and I'm using a 1 cc or 1 milliliter syringe, and for tuberculin I'm going to administer 0.1 milliliters. So I'm going to go ahead and set my plunger at 0.1. Go ahead and take the top off of the needle, and I'm going to place it down into the vial, and I'm going to put in the same amount of air that I'm going to take out. And once I've done that, I'm going to go ahead and draw up the medication, trying to make sure we got no bubbles in there. And again, tuberculin, I just want to administer 0.1 milliliters. And so once I have that, I can kind of flick the side and get the bubbles out. And so once I have the medication ready, I'm going to go ahead and place the top back on. And now we're going to go into the room and meet the patient. So once I get in there, I'm going to verify with two identifiers the patient. So name and date of birth is usually a good way to identify, and explain to them that the physician is ordering a tuberculin test for, usually it's a physical or before, like a safety precaution for work. So once I visit with them a little bit, I'm also going to explain to them that I'm going to give the test about 4 inches below the bend of the elbow, and just right under the skin on the forearm. And so once I'm done that, I'm going to wash my hands, make sure and do that, and don my gloves here. So I'm going to take another alcohol swab, and in my spot that I've chosen, I'm going to go ahead and I'm going to clean, and I'm going to start in the middle using a circular motion, making a circle going out, pushing the dirt out to the outer edges. And once I've done that, I'll let the alcohol dry. Without blowing it, I won't blow it dry. But once the alcohol is dry, then I will remove the cap on my syringe. I'm going to go ahead and grab it with my thumb and my forefinger with my dominant hand, kind of pull the skin back a little bit, and I'm going to insert with the bevel up about 1/8 of an inch just under the skin. Just under the skin. And once I do that, I'm going to go ahead and slowly administer the medication, and I should get a nice little wheal, and I did. I'm going to go ahead and put the cap back on this and put my needle in the sharps and see if I can show you. I don't know if you can see the wheel on my chicken there. My chicken patient. So I'm going to draw a circle about 1 inch around where I administered my medication and explain to the patient that it's important to come back in 48 hours and have that checked for any reaction to the medication. And if there's any blood there, I'm going to just dab it a little, not much, and then go ahead and let the patient be on their way. I'm going to go ahead and take off my gloves and wash my hands, and then once I'm done and I've explained everything to the patient, I'm going to go ahead and document what the medication was that I gave, the route that I gave it, the amount that I gave, the time that I gave it. So that is my intradermal injection demonstration.